Why are lymph node TB symptoms often missed? Imagine feeling a small, painless lump in your neck that slowly grows over weeks or months. It might not seem urgent, so you ignore it. This is a common experience with lymph node tuberculosis, also called tuberculous lymphadenitis. The reason it often goes unnoticed or undiagnosed is because its symptoms are subtle and develop gradually. Usually, the first signs are mild swelling of the lymph nodes, which can be mistaken for simple infections or benign cysts. Many people don't have fever or other obvious symptoms at first, or they might think they just have a minor cold or stress. Because these symptoms are so nonspecific, they can easily be attributed to less serious conditions, which delays seeking medical help. Another reason symptoms are missed is that lymph node TB can look like many other diseases. It can mimic bacterial infections, certain cancers like lymphoma, or other granulomatous diseases. For example, both TB and lymphoma can cause fever, night sweats, weight loss, and swollen lymph nodes. This overlap makes it tricky for doctors to tell what's causing the symptoms without further testing. Sometimes, initial tests like blood work or imaging aren't enough to make a clear diagnosis. Confirming TB usually requires examining tissue from the lymph node, either through a biopsy or fine needle aspiration. Microbiological tests, such as cultures or molecular tests, can take time or may not always find the bacteria, especially since the bacteria are often present in low numbers. Histopathology can show granulomas, but this alone isn't specific to TB, so additional tests are needed. In regions where tuberculosis is less common, healthcare providers might not immediately think of TB as a cause of swollen lymph nodes. This low suspicion can lead to misdiagnosis or delayed diagnosis, especially if the symptoms are mild or atypical. The situation becomes even more complex in people with weakened immune systems, like those with HIV or diabetes. Their symptoms may be less typical or masked by other infections, making it harder to recognize TB as the cause. There is no simple blood test that can definitively diagnose lymph node TB. Blood markers like inflammation levels can suggest something is wrong but cannot confirm TB. This means doctors often relying on tissue samples and microbiological testing, which can be invasive and time-consuming. Because of all these factors, early detection depends heavily on awareness. Recognizing that persistent, painless lymph node swelling could be a sign of tuberculosis is crucial, especially in at-risk populations. When suspicion arises, appropriate diagnostic tools like fine needle aspiration, molecular testing, and biopsy should be used to confirm the diagnosis. Consulting healthcare professionals is essential for proper evaluation and treatment. Remember, every case can be different, and only a medical expert can provide personalized advice based on individual health circumstances.